going to look at assessing ribs in supine with passive overpressure. So the most common way to assess ribs is with respiration. So you palpate, the patient's going to take an exaggerated breath, and you will feel resistance to some of the movement, but usually what you do is pay attention to your hands and you'll be able to visualize the asymmetry. However, sometimes what you want to know is more about the specified movement of the ribs in particular planes of motion. So we do have the ability to overpressure into midline on both sides, and we have the ability to overpressure from anterior to posterior, especially when we get more into the common costal cartilage. And that's where we're going to work right now, as opposed to going into the upper ribs, which is going to stay down lower, so mid-axillary line and the common costal cartilage region. One of the things you want to be careful with is that you're not moving the patient's whole body all over the place. So I want to have one side of the rib cage moving and the other side, or really everything else, staying relatively still. So I'm going to have to stabilize one side, move the other side, stabilize one side, move the other side, and then we're going to go anterior to posterior just to try to get an idea of what the heck might be going on. This is not always a valuable test, but there may be times where you're curious about the ribs and you would like to investigate further, and passive overpressure is an option, right? So we use our eyes, we assume, generally speaking, where the bottom of the costal cartilage is, as opposed to poking around in somebody's tummy and trying to find it. You just use your eyes, you go to the region, and then you'll be able to adjust up or down. If the bottom of your hand relatively feels some of the lateral abdominal tissue, so the obliques, then you're probably in a decent spot. Depending on the size of your hand and the size of the patient, you'll have to adjust in a variety of ways. But right here, we just come down, okay, we've got more or less the side. In a lot of cases, it's smart to bring your thumb in so that you are aware of where your thumb is and it's not wandering into sensitive areas. So you bring your thumb in, right? Push there, push there. Under the circumstances, you would agree that this side has more resistance to it. Now, I am in an uneven place. To confirm that, it would be smart for me to go to the other side and do the test on the other side, because I'm off angle. So it would be very useful for me to go to the other side to confirm, but you wouldn't see anything because my back would be to the camera and obscuring everything. Now, the posterior or the anterior to posterior, in this case, you could use your hands this way. You can go here, you can go here. Circumstantially, I'm going to have a hard time with it, with my hands, my wrists, my ability to turn. So I'm going to use my thumbs in this case, and I'm going to use them as broadly as I can and utilize my thenar, right? So I'm just going to push down and push down. Now, under the circumstances, again, when I push down there, there's resistance to it, but there's more resistance over here. You agree? All right, so I have two findings of resistance to overpressure on the right side. Nothing's particularly challenging to the respiration. None of it's uncomfortable. It's all manageable. So I have identified that, at least within the confines of those tests, that I'm curious about the right side.